Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. I'm joined with Adam Thacker this morning, who's our Chief Operating Officer of Good Samaritan Hospital. We will be giving you our usual weekly update on the status of COVID-19 in our community, what our response has been, a bit of the usuals, which is, of course, our total numbers, our testing, potential upcoming vaccines, and then basically what we need to be looking at for over the course of the next couple months or so. So starting off with numbers, 187 total cases active in our community right now, which is the highest number that we have seen. The other thing that you will hear us reference every week, of course, is the positivity rate, which in the state is lower, but with us has been higher, around 9% for all individuals, but the one that we speak the most about, which is unique individual rate, is almost 30%. Which is the highest number that we have seen. And so as we spoke about last week, there has never been a time for us to all be more vigilant as far as following our masking guidelines, our personal hygiene issues. And then the big thing that we keep coming back to is masking and why that is so important. Because as we see more active members in the community and active cases that are going around, we realize that there's more of that potential virus to spread. And the way that I'm protecting you and the way that you're protecting me is through masking. And so it's very important to realize that when we are out and about, or more importantly, as we go into the season of the holidays, we just passed up Halloween, but as we go into all the other holidays that we have over the course of the next couple of months, it's very important that not just when you're out at retail facilities, grocery stores, restaurants, so forth, but when you're in family gatherings to continue to mask.
And I think it's important as we talk about that positivity rate to understand in a comparison standpoint, the state unique positivity rate is 15%. So we have doubled what statewide looks like, and that number certainly is the highest that we've seen, which puts all of that emphasis on what we're doing in preventing illness. And kind of breaking down the masking discussion a little bit, we know that that wearing a mask is not 100% foolproof, but there are a couple of things to understand. One, it decreases the risk of transmission if we all do our part. If 20% of us wear a mask and 80% don't, or even 50-50, it's somewhat of a moot point. This takes everybody being individually accountable to, I'm going to wear a mask to protect the people around me, not necessarily to protect yourself. The mask is more of protecting your breathing, your expulsion of respiratory droplets from infecting somebody else. And you're seeing a lot of data, and certainly social media, political agendas all get thrown into this about how the virus works and, is it just another flu? Well, regardless, what we know is our older population, our population that have heart, lung illness are at risk and have a higher mortality than we see with other viruses. So you're protecting that population, and we can all do our piece in helping with that. And as Dr. Stine mentioned, we just crossed Halloween, and we've got other events coming up, and we're moving into the fall with indoors, and I'm certainly hearing, and I'm sure you field a lot of questions in the community too about, we're really scared about shutdown and the impact that has on mental health and activities and all of those things. And we have school-age children and certainly want a normal life, whatever normal was in 2019, but that's not the case right now, and we've got to think from a public health standpoint as to how we're protecting everybody, and it's a balancing act. What we know is we have to all be accountable to taking these steps so that activities can happen in a safe manner, and it's going to look and feel a little bit different, but we're hopeful that those things can happen if we're doing that safely. Now, if positivity rates continue to climb, active cases continue to climb, other measures will be taken, and ideally we control that fate more than decisions having to be made because really it's ineffective what we're doing today.
Yep. Another thing to be really, really cognizant of is symptomatology. So what we are finding over the course of the past several weeks or so is as more and more individuals are coming down with symptoms and coming up with positive tests, is that many people are misinterpreting those early symptoms. And that's easy to do because we are going into cold and flu season right now. The weather's changing. We have been finishing out harvest, so allergies have been terrible. But the thing that seems to be most common in the patients that I've dealt with that have had positive tests are certainly the upper respiratory cold type symptoms, some mild fever symptoms coming on, maybe even some aches and pains. And then it's not necessarily right off the bat that people develop the loss of taste and smell. That does still seem to be a very common symptom that people are reporting, but it's very important to realize that you need to be watchful of those early symptoms. When we see flu come around, flu's a little bit easier to distinguish because it's fairly rapid onset in symptoms. People go from feeling normal to terrible just within a few hours or so, and so it's a little bit easier to separate that than what we see with coronavirus. And that is that the first symptoms are relatively mild. So it's important to make sure that if you start developing those early symptoms, to make sure and pull yourself out. Stay home from work, stay home from school. If your kids are showing those early symptoms, assume that they are maybe potentially becoming symptomatic, and they should be held back as well as everybody else in the household.
And that loss of taste and smell that you mentioned, it's not as black and white as that. I've had a number of individuals I've spoken to that have tested positive, and it's been really a change in taste or smell. Things taste different, and then it may progress to a loss, but it's more of a change. And so what Dr. Stine is getting to is you get a lot of instructions from healthcare providers as whether it's the health office, whether it's our testing sites, et cetera, our triage line, as to a quarantine due to testing positive, and then what an exposure looks like. So kind of going over those details. For the majority of the population, which we know 80+% are going to be mild to moderate, if you develop symptoms and then are tested and test positive for coronavirus, that 10-day number that you hear goes to the onset of symptoms. So that's why it's really important that we are self-checking for symptoms and understanding, okay, when did my symptoms start? And that starts the clock on that 10 days. So, and then at the end of that 10 days, so long as symptoms have resolved or we don't have a fever, then that quarantine stops and individual is considered recovered and can return to normal activities. As some of you may have heard the 20 days, which can cause some confusion. That is for severe illness, and that would really think hospitalized patients coming out of the hospital, and they're going to have a different care plan per CDC, that it's a 20-day isolation period. And then exposure. So anytime we have somebody in the community that tests positive, there's the contact tracing. Much of that is happening at a state level. Some of that is happening at a local health department level, but that's coordinated between state health department and local health department. A lot of it is a state level, and it's really important if you're the individual that tests positive, you get that phone call from the state that you are responding to that and then going through that contact tracing. So if you're a direct exposure, that is a 14-day quarantine based off of last known exposure. So for an example, if you were around somebody yesterday that tests positive, then that would be the last known exposure, and then it would be 14 days from that point. The reason, and it's been since March, we kind of handle this is confusing. Why does patient that tests positive get 10 days and I get 14? It's because once that exposure happens, we have 2 to 14-day incubation period that you can present with illness. And so that's where the 14 days comes from. We're following that per CDC. That is how the state is following that. And then if there is repeat exposure, the 14 days keeps resetting. So that's something that we have to understand, and that's where having a plan in your home to isolate away from other individuals so the 14 days doesn't reset, that's where if you have been contacted, you've tested positive, that being very vigilant about not leaving your home, having that plan of, okay, how will I get supplies from work or supplies for home just to get by during that time, is really important that we have that pre-made plan. Pre-COVID, we talked about having a fire escape plan at home, having a plan where your family would meet, all of those safety measures. It's important to have that today as well in the era that we're in with coronavirus.
As Adam was saying, one of the most logistically challenging things is when you have a positive family member and how you isolate that individual, because if you don't manage to take that individual and isolate them from the remainder of the family, then each day that goes by is another potential exposure. And so logistically, that becomes a big issue for many people. So it's important to realize once you have a positive member in the household, that individual that is positive is treated differently than everybody else who's quarantining. And so the quarantine period would reset each time that they're re-exposed. So guest bedroom, comfortable closet, wherever you'd like to go. But the bottom line is that individual needs to be separated out. And the interesting thing that we have seen, and this goes back to when this began, is in individuals that had positive household members that were appropriately isolated, there was very little spread within households, which I think is quite remarkable when you figure what we've been talking about. But when we go back and look at all that contact tracing that was done early on by Dr. Stewart in the first cases during the first 3 to 4 months of this, we saw very little spread within households that appropriately isolated and then quarantined. So this stuff works, just as masking works, the isolation and quarantine periods work as well. And then the other thing to really make sure that we're cognizant of is when those symptoms resolve. As Adam said, we've tried to be very conservative on making sure that 72 hours goes by from the time those symptoms resolve before you're okay to return back. And we think that is one of the safest ways to look at it as far as returning back to school, returning back to work, and being around people again. So we ask everybody to be very vigilant as it pertains to our masking, our hand hygiene, and then if you have questions, the resource that we use is the CDC's website, and it's very easy to navigate. It's very simple to see where the quarantine section is, where the isolation section is, and what the timing is on all that. We realize that as more and more people within our communities are positive, it's much more difficult for the state and our local authorities to do that contact tracing and give the appropriate education that goes along with it because it's so many people. So that resource is available all the time on the CDC's website, and that's where we tend to go to as well.
Right. You know, another element of this comes in the testing piece. Mm-hmm. So if you are a direct exposure, getting tested has no bearing on the 14 days. We get that question a lot. Well, if I can get tested and I'm negative, does that change anything? It does not, because based off that incubation period, the testing at that time and interval may just miss the incubation of the virus within your body. So that does not. And then from a testing standpoint, a negative test result at the end of the 10 days if you've tested positive is also not recommended. Per CDC, actually, once you've tested positive, you should not be retested for 90 days. And so negative test results to return to work for our working population is not appropriate. Actually, the Indiana State Department of Health sent something out last week. We don't know about next week. They sent something out last week that stated that was not appropriate, and negative test results should not be requested by employers as a return to work expectation. Our test sites are still set up at Convenient Care and the Medical Center of Vincennes, get assessed by a provider and be able to provide that testing, have ample supplies to be able to do that. We're seeing a lot of folks come through, and that flow seems to be working very well, so that will continue to be our test sites at this time, and we're evaluating that on a weekly basis.
And what we generally see is when patients call and ask us either through our triage line or through virtual visits or so forth as to when they should get tested, really what we like to do is try to get our nurses on the phone and us on the phone to talk with these patients to determine what the appropriate next steps are. We don't want to send somebody back into a work environment, a school environment, and potentially cause that to be a contact person for everybody else. We also don't want to do that unnecessarily. So the biggest and most effective way to deal with that is just make sure you make contact with your providers, your primary care physicians, your pediatricians, internal medicine and family doctors to help with that decision-making process. Because again, we still see all the same illnesses that we normally would. And then it also helps to differentiate that breaking point where we get more concerned about patients and it's time for them to come into the hospital. We've had anywhere from the teens to the 20s as far as numbers in the hospital that have been positive for COVID. So this has been a very busy time for the hospital, but it's important to realize that there's a point at which we need to help patients understand, hey, you're sick enough now from a respiratory support standpoint that you need to come in and be supported in the hospital. That being said, patients have been doing a great job recovering, even when they have had to be hospitalized, returning back home. But if there's ever any question, specifically with lower respiratory symptoms, feeling increasingly short of breath, not being able to do your normal daily tasks that you would do as far as ambulating around the house, walking from one location to another, preparing your meals, doing laundry, things like that that have become increasingly difficult because of shortness of breath, that absolutely should be a trigger to get in contact with your provider and determine if testing needs to be done and if we need to get you in the hospital for observation. Other things that we talk a little bit about, obviously, is when's the vaccine coming and where are we at with the vaccine. What we know from our flu vaccination is that the logistics are laid out and we are capable of administering vaccine over a very short period of time to a lot of people. That's already been laid out. We've been told by the state government and federal government to be prepared for mass distribution of that vaccine. We do not have any solid time on when that's come out, unfortunately.
No, the latest communication end of last week was some anticipation towards the end of November for what's called phase 1 distribution, but there's still the FDA processes that are being worked through. Nothing has really changed on that front of a phased rollout, meaning that patient-facing critical healthcare workers would be at the front of the line from a vaccination standpoint, and then our vulnerable populations, and then it would move on through from a healthy population really over the course of the next year. But that end of November availability is not determined at this point. That all is bearing an FDA approval, and then it's a federal rollout, and the different states get different allocated amounts. So what that will look like still remains to be seen.
And when that vaccine comes out, people have asked frequently, will that be the end of it? We can pull the sheet off, pull the masks off, go back outside and play and be around each other. And unfortunately, not to be doom and gloom about things, but the answer is no. The period of time that it will take from the time that the vaccination is released until we have a large enough or critical mass of the population to be vaccinated to basically not see that spread, specifically that community-based spread, is probably going to be anywhere from 6 to 12 months from the time of the start of distribution. And that will vary greatly upon how much of the population is vaccinated, how quickly they are vaccinated, and then, of course, the season of the year. So no different than we're seeing an increased rise as we go into the fall of the year. And we're very fortunate that this all started in the spring of the year. We're all looking forward to the fact that the sun will come out in the spring and we'll all go outside and open the windows and so forth. But we need to be prepared that as we go into these winter months, everything that Adam had alluded to in terms of making sure that within your own homes you have plans in place for that isolation, for that quarantine, and plans in place for vulnerable family members, because we realize that if we want to stay in touch with our older population and make sure that they have the supplies that they need, if we happen to become isolated, that they still have the resources that they need to continue out through the winter months. Visitation, any changes in our visitation policies since we've talked over the last couple weeks or so?
So no changes to the visitation policy as far as one visitor allowed across the continuum of care, but many of you probably did receive via our MyChart communication or saw on social media that we did send out a communication asking everybody to be thoughtful in bringing a visitor to medical office or ambulatory surgery areas, ancillary, so think testing like getting a lab draw or going to a respiratory therapy or an x-ray, those types of areas. Just to be thoughtful that if you need a visitor to come with you to help with mobility, ambulating to and from the visit, or with medical information that is being shared because you have a loved one that can help in understanding the communication, we absolutely support that. But if somebody is coming more out of convenience, then we ask that we do keep the traffic down in the hospital as we're looking to do everywhere. So no changes to our policy, but we are asking the community to be thoughtful in those types of visits where maybe visitation can go down. And again, it all comes down to exposure. I mean, we are, from a hospital safety standpoint, I mean, I can confidently say that our infection control practices, our compliance with public health measures is excellent, and our staff are doing everything they can to protect everyone, and the people entering the building are being screened and going through all of that. But still, the number of people that we reduced just reduces risk overall. You will be screened upon coming in, just as always. A mask is required within Good Samaritan. If you are unable to wear a mask, which is a very limited population, but there is a population, then we do have disposable face shield that we would be able to provide. But as a patient at Good Samaritan, unless it's emergency care that trumps that activity, a face mask or a face shield is absolutely a mandatory aspect because we have to protect everyone within our buildings.
Yep. And as we move into the next 24 hours or so with voting going on, we want to encourage everybody to get out and vote, but we also want to make sure that they understand that that is another opportunity for mass assembly of people. And we've been very fortunate. Sir Shelton has done a great job giving us an offering over the course of the past month or so to get out and vote ahead of time. I voted last week, very convenient, walk up just across from the courthouse, done in 5 minutes. And so if you have opportunities to have mailed in your ballots, handed in your ballots, gone for early voting, please take advantage of those. There's still time left to do that because we do want to avoid the mass assembly of people that typically goes along with our voting on Tuesday.
Absolutely.
Any questions that we have from the folks on the phones?
Yeah, we have a few this morning.
Okay.
So talking about testing and turnaround time. So here locally, what is that testing turnaround time?
We're still seeing 2 to 3 days as a standard turnaround time. So pretty much that 3 days is very consistent that we see turnaround time. There's always a little bit of flux with that depending on when the test was drawn and when the courier happens and those logistics of that. But 3 days. We did receive last week some additional rapid testing capability that we are using in the event that there are large employer outbreaks or any type of mass testing that is needed to be provided at specific areas. But the typical testing turnaround time is 3 days.
And then maybe just to add to that, the protocol for someone that comes in to be tested, just either symptomatic or curiosity,
Sure.
What do they follow after a test?
Yeah, actually, so going to either one of our testing sites, MCV would be directed by one of our primary care providers that either through virtual or phone call or a physical assessment would determine you need to be tested. At the convenient care, we have our staff there, and you'll be assessed by a provider. We also are providing at convenient care through a state Department of Health collaboration that asymptomatic individuals can come there and be tested out of that kind of curiosity aspect. We don't necessarily recommend that you need to be tested because it's just a point in time that tells you what's going on right there, but certainly symptomatic be tested. It's important to understand if you have been tested, that during that 3 days until the results are returned, you are assumed positive. So a pending test is assumed positive. You should not, and we absolutely would say cannot, go be tested and then resume normal activities until you get the results and then run the risk that that's positive, and for 3 days you have potentially been around who knows how many people in a work environment or personal environment. So any pending test, and you'll get the home instructions that will state this as you have been tested. Once you have been tested, you're assumed positive until told otherwise.
And therefore, you should be isolated. If you return
Absolutely.
back to your home and you are staying away from work, consider yourself positive at that point in time. That's where a lot of times people sort of back themselves into a corner, is that they go in to get tested because maybe they're symptomatic or they're concerned about being symptomatic. They return back to their homes. They are not isolating within their home, even though they're presumed to be positive. And now each member of that household is a primary contact and should be quarantined.
Right.
So that's a really important differentiation there. And I think a lot of people are calling in with questions about, well, so-and-so is being tested, so it's okay that the rest of us continue to go to work and go to school. And the answer is no. That person needs to be isolated at home and presumed positive. Once that test is returned negative, then it's okay to return back to normal activities.
Now, someone asked about the positive test results in the community. Are some of those related, or are they random?
Related, yes, but it's not just one area, one large outbreak has drove the whole number up. I mean, really, when we use the terminology widespread community transmission, I mean, that's what we're seeing. There may be a pocket of 5 individuals here or 10, but we're not seeing that. Our numbers have more than doubled in the last 45 days.
Yep.
And that has not been due to one area. That has been really spread across the community in multiple settings, and that's why we're really hammering on the public health measures and driving that down. It's not one isolated event. I know in some communities, early on it was Cass County and there was a manufacturing, and they had 200 positives all in one location. Knox County, we have not seen that. It has been pretty much a steady growth of widespread transmission.
And the good news about that is that we don't have these pockets of explosion. The bad news is we know that exponentially, as we see more cases and those cases are more evenly distributed throughout the community, that there's more potential opportunity for you to encounter an individual like that. What we also know, though, however, is when places are vigilant about their measures, when they are vigilant about masking, when they are extra cautious about hand hygiene and everything else, and we know this within our own facility, then the numbers of transmitted cases are zero or very low. We've had a number of manufacturing facilities here in town that over the course of the last several months had individuals that turned up positive, and the places that did an excellent job of the hand hygiene, the masking, sanitation, had no continuation of that. And we've been very fortunate within our facility to have the same situation, that when people are very vigilant about that, we do not see that transmission. And what that means is the measures that are being taken work. So it's important to realize that this is not all for naught. This is being done for specific reasons, and when it is done properly, it works.
Now, someone asked if hospital workers are going to be required to take the vaccine.
Yes.
Yes, and that's no different than for many years. I can tell you when it started, the influenza vaccine has been a mandatory requirement for healthcare workers. Now, as vaccines get approved, there is always a list of exclusions due to allergies, and if somebody has, we were asked about Guillain-Barré last week, if somebody has a recent or a past exposure concern to a vaccine, all of that is taken into account. But yes, as a general rule, those mandates do not come from Good Samaritan. I think sometimes it's viewed as we're locally saying this is mandated. That mandate will actually come from the Advisory Committee of Immunization Practice, which is a federal group that says healthcare workers, this is a requirement, and it becomes contingent on our federal funding that you have to do that.
Are you still doing antibody testing?
We are. Our lab does antibody testing. I can tell you the exact number, but we've seen an increase in request for antibody testing. What hasn't changed, and we talked about this many months ago, it seems, but that is really out of curiosity of knowing if you've had a past exposure where maybe you didn't have symptoms, but you were told you were exposed at some point. So it's a knowledge base just to be able to gain. It does not impact the public health measures that we're talking about. You can't stop washing your hands. You can't stop wearing your mask. If you are considered an exposure, you will still have to follow all of those guidelines, and with your employer as well. So that's important to understand. It's something to know from a curiosity standpoint, but it doesn't change your behavior.
It's been nice because that test that we've been offering is relatively inexpensive. So we've had a number of people that have opted to be tested for that. But as Adam said, it doesn't really change how we address the issues. That being said, from what we know and what we've seen, the likelihood of reinfection after initially being infected is extremely low. For those individuals who have been positive, who have recovered from the illness, the likelihood of them reacquiring the infection is extremely low. That being said, we can't necessarily translate that over to a positive antibody test that may have occurred in February, March, April. We don't really know because it doesn't tell us that. But a number of people have been curious enough, and there are several offerings for that. We have it through our lab. When you go to donate blood
Yes.
They will automatically do an antibody test on you and contact you if that has been positive as well. So yes, that testing is available. It's a relatively simple blood draw test, and the antibody test comes back within a very short period of time as well.
It is a provider-ordered test,
Yes.
so you can't. We have a lot of walk-in opportunities for our lab. You can't walk in and just request that test. You would need to speak with your provider about having that ordered.
Now, out of the positive cases in the community, what about hospitalized patients? Are we seeing many hospitalized patients?
So we've definitely had more hospitalized patients. The important thing to realize is, although we have had a number of critically ill patients in our ICU that have been ventilated, the majority of the patients that we've seen in the hospital have not been in the ICU, and they have moderate to severe illness. They're under supportive care. But it's important to realize that from a resource standpoint, number of hospital beds, number available ventilators, we've been fine with that. The problem has become that those individuals that are very, very severely ill have been on ventilators for extended periods of time. And whereas normally in any given hospital's ICU, an ICU stay is relatively short, just a few days of being ventilated and supported, patients who get to that point with coronavirus unfortunately end up being ventilated for long periods of time, and that's been one of the challenges that we have had. When we look within our district, the available beds, the available ventilators is fine, but it's important to realize that we've had in the 20s over the last several days as far as the number of hospitalized patients with COVID-19. That also increases the amount of staff required to take care of those patients. And really, from a resource standpoint, that has become the bigger challenge, is not necessarily number of ventilators available, number of negative pressure rooms, number of hospital beds. We've been well equipped for that, but it's become increasingly challenging because of staffing.
About 2/3 of the patients today are on what's called a general medical floor versus the ICU from a COVID standpoint. But we are entering a generally busier season pre-COVID. And as Dr. Stine mentioned, the biggest impact is on our staff. So our nurses, our physicians, our environmental services, our respiratory therapists that are going in and out of their rooms. And this patient population takes a lot of care, and there is a lot going on, and we're still learning a lot. And so understanding that an increase in active cases in the community and increased community transmission has a lagging effect to patients going to be hospitalized. If you know folks that work in the professions that I just mentioned, and they're your friends, or you see them at events and you know them, I mean, the stress that not following those precautions is putting on our staff is pretty immense, and just both mentally and physically. A lot of folks are working a lot of hours, and very early on in March, I mean, there was all of the discussion of the overwhelming component to healthcare, and we certainly haven't seen that where it has been overwhelming, but it is a long dragging effect that we're seeing. So again, I think we've said it many times today, but again, if we can drive down community transmission through public health behaviors that we know have an effect, it does keep patients out of the hospital, and ultimately saves lives at the end of the day.
Now, how are we keeping family members informed of the status of their loved ones that are inpatients and in isolation with COVID?
Sure. A lot of different ways, and communication is an always evolving and very complex event. So our medical team of physicians, whether that be a hospitalist, we have incorporated our medical residents into that, are communicating with the family on a daily scheduled event to keep that caregiver that has been identified as that direct contact, who then can communicate to the rest of the family in the know about what is going on from a medical standpoint. Our nursing team is also calling that identified individual on a daily basis. And then if there are any changes in status, if a procedure is needed, if somebody is needed to be moved from one level of care to another, those types of communications happen on a regular basis, and try to keep that communication up as much as possible. And then certainly can call the hospital, but we ask that, control that to a point that you have that identified caregiver for your family member that does the communication, and then have a phone tree to the rest of the family. Having 10 family members call in all at once about one family member, again, puts the burden on our team and takes them away from the bedside where their time is most essential.
And then as far as visitation, we instituted a few weeks ago the window visitation, which has gone very well, where family members are escorted up to the ICU and are able to see and observe their family members and what their condition is, and also speak with the medical team at that time. So that's been very well received. We've had a lot of good feedback from family members who have been involved in that, and it basically keeps us more tied in and yet limits that exposure that the family would have to deal with.
Okay, I think that's all the questions. Just a comment. Thank you all for your hard work, keeping us safe and healthy. You're doing a great job.
Well, thank you.
We appreciate all the measures that everybody is taking. Again, as we go into the course of the next several months, it's important that we stick with what we've been talking about, the importance of masking, the importance of hand hygiene, and then the importance of what Adam and I have talked about today, which is that guidance on isolation, that guidance on quarantine. And if you have any questions about that, please contact us, your primary care providers, get on the CDC's website, because that's what's going to get us out of this over the course of the next several months. We thank you all for being with us, and we'll be with you again in a week.